So right now, Seattle Children's is facing violations from two different agencies, the State Department of Health and a federal agency. The operating rooms, they reopened on July 4th. And we're learning also on that day, the Department of Health met with the hospital to talk about safeguards put in place to protect visitors and patients from dangerous mold that led to one patient's death and infected 5 others. Today, I asked the Department of Health if it gave Seattle Children's the green light to reopen the operating rooms, and a spokesperson said the Department of Health doesn't have the authority to tell the hospital whether it could or couldn't open its operating rooms, which had been closed for 6 weeks. Now, in that time, federal inspectors visited the hospital for 3 days and they issued a report. We read that report and counted more than 24 violations, including the failure to maintain air filtering systems for operating rooms and implement the hospital's infection improvement plan. The report actually said, quote, "The failure to ensure oversight of the program that prevents infections puts patients, staff, and visitors at risk of harm from environmental pathogens." So we're learning that on June 27th, the hospital did provide a plan of corrections to both the feds and the state. But as of today, I spoke to both agencies and neither of those plans have been approved. The hospital did say it's done more than what's required in the buildings code to make those operating rooms safe.